Hi, my name is Samantha Spencer, and I'm a licensed physical therapist specializing in prenatal, postpartum, and pelvic health. Unfortunately, there's not a lot of great information out there for new moms who are looking to get back into their exercise routine. Maybe you're trying to get back to the gym, maybe you want to get back to your running program, or maybe you want to just run around the yard with your older kids. But the internet is full of kind of scary and limiting information, and sometimes healthcare providers are minimally helpful in guiding your return to fitness. So today what I want to talk about is getting back into your program safely, efficiently, and with a structured mindset so that you're picking up all the pieces that were affected during birth and postpartum, and really rehabbing those areas so that they are strong and mobile and ready for more. We're going to start by talking about those early weeks, and then we're going to move into what you can be doing during the fourth trimester. So, all the way up to 12 or even 16 weeks postpartum, and then how to really ramp up your intensity after that safely and efficiently. So let's start just by talking about safety. During those early weeks postpartum, you're really going to want to listen to your healthcare provider and take it easy for a while. If you're noticing increased bleeding, that might be a sign that you're doing too much too soon. Or if you're having heaviness, pain, pressure, or any issue with your redness or separation of your C-section incision, then you certainly want to be contacting your healthcare provider and making sure that your healing is on the right track. Let's begin by talking about a few things you can be doing in those initial early weeks when you're still taking it easy. One of the best things you can do is just breathe into your body and move your muscles. Just reconnect with some of these areas that were so heavily affected by pregnancy and then birth. So the pelvic floor, the abdominal wall are big ones. So when we breathe, we inhale and our diaphragm drops down, and so does our pelvic floor. So take a deep breath with me and just let your muscles go and fill up that space with your breath. As you exhale, we can follow that breath and feel your muscles just slightly, gently tightening. So we inhale, we let everything go. We exhale, we pick up from the pelvic floor and feel those core abdominal muscles gently kicking in. So if you're doing this in sitting, if you're sitting in a chair or on the couch, you might feel that pressure of your perineum against the surface that you're sitting on. So we inhale, we relax. We exhale, we're gently drawing in. So this is one of the most crucial things that we can do in the early weeks to just gently bring our nerves and muscles back on board. Bring everything kind of back together. Wake all these areas up so that they're connecting as we move into more strenuous activity in the weeks to come. So let's try this lying on our backs, and then we're going to flip over to hands and knees as well. So if we're lying down, you can be in the bed, on the couch, on the floor, wherever you're the most comfortable. This is an excellent place to start because from this position, you can feel if you're shifting around, you can see whatever other muscles might be kicking in that we really don't need. For instance, if I am working too hard, I might start to tuck my tail and smush my back against the floor. So let's reset, shake it out. You want to have a nice little comfortable arch here under your low back. Your spine is nice and long and relaxed. Your glutes and hips are relaxed and your legs are relaxed. We're going to breathe in, feel the lower belly expand, and then breathe out. Gently find the muscles between your sits bones. Pick them up just ever so slightly and feel all your abdominal muscles gently drawing in towards your spine. We're not trying to squish the floor. We're not trying to squeeze the glutes, right? Check in with the rest of your body. Make sure everything else is gentle and relaxed. Inhale, let everything go. Exhale, gently pick up at that pelvic floor. Good. You might feel the abdominal wall as well. So one thing to note is that especially after a vaginal delivery, but also after a C-section, this whole area of your body might feel really disconnected. You might feel really weird doing some of these exercises that you have done before and felt good about, maybe during pregnancy. But everything has been just kind of, we could think of it like an injury, right? So we need to bring everything back on board, but with very, low expectation as far as how strong things might feel and how robust all those muscles are. Things really do need time. Our bodies need weeks to recover from this. So if you think about it like a sports injury, give yourself a little grace, and if things feel weird, just keep at it. Just go gently along each day. I would say do 10 in the morning, 10 in the middle of the day, and 10 at night. And if you're not sure if you're doing this correctly, it's a great time to talk to your healthcare provider and/or find a pelvic physical therapist in your area. Now let's flip to hands and knees. So how are we going to do that safely? We want to do that little exhale as we're moving. We're going to start by rolling to the side and then press up with your arms. That log roll strategy helps us to keep from putting a ton of pressure downward. If we just do a crunch like this, then we're putting a lot of pressure down into the pelvic floor. So by rolling over to the side and exhaling every time we do something hard, we're really setting ourselves up to protect our core and pelvic floor along the way. Now let's come to hands and knees. This is an easy one to do with the baby, right? So in hands and knees, you can feel where your spine is and how long and controlled everything is. If you notice that you're trying to flatten your back or you're rounding, you may want to lengthen your spine a bit more. Try to bring some natural curves to your low back. So if I were upright, I would have a little bit of a curve in my lower back. I'm going to keep that curve as I come down to hands and knees. This is a beautiful position for reconnecting with all of those muscles. So we inhale, let everything go. Gently exhale. It might be easier to feel your abdominals here, but you can also tap into your pelvic floor. Inhale, let it all go. Exhale, pick up on that pelvic floor. So one of the things I like about this position is that you can tell if you're overworking, right? So if you get to this point and then you realize, oh, every time I contract my abdominals, I'm doing this, that's maybe working a little too hard. So shoulders are back, chest is long, and all your little natural curves in your spine just stay right where they are. All I'm doing is moving my muscles around my structure. So that's a beautiful place to start. Just practicing in both of those positions a few times a day will help bring all of these muscles back on board and set you up for feeling strong down the road. Next, we're going to look at a sit to stand, because I'm sure as a new mom, you're probably doing that a million times a day, getting up and down out of the couch or out of the bed or out of a chair, sometimes with your baby in your arms. So we want to do that safely and be moving forward and using it as an opportunity to build our foundation. As we move into a sit to stand, we're going to use some of those same concepts that we just applied in some of these very neutral positions. So we're going to exhale, and as we do that, we're going to pick up that pelvic floor and bring our abdominal wall in. Again, these muscles might not feel very strong. You were just pregnant with a baby pushing out from the inside, and now that baby's not in there anymore. So whether you've had a C-section or a vaginal delivery, we want to give ourselves some grace and just continue practicing. We have 100 million times a day to practice this, don't we? So just working through with what you can feel, and then over the days and weeks, you're gonna feel stronger and stronger. So as we go to stand, we're gonna lean forward, right? Scoot to the edge of the chair, lean forward until you feel your body wanting to lift up off the seat. So sometimes you might wanna bring your feet in closer, and we certainly want to hinge at the hips, keep the spine nice and long. Once we're ready to go ahead and stand, that's when we exhale and pick up those muscles. So I'm feeling my pelvic floor and my abdominal wall just gently hugging in towards my spine. And then we inhale and come back down. So nice tall spine. Let's try it again. Exhale. Pick up all those muscles and come to a complete stand. What we want to be mindful of is that we're not overdoing. We don't need to go to here, right? We're just trying to lift and stabilize from these deep muscles that hold us up. So, why are we doing this? Well, if we're getting out of a chair, especially holding a baby, and we're not feeling super strong in this area, we might revert to strategies like holding our breath, right? If you do that, you'll notice pressure going downward. When we come from a sit to stand and we're holding our breath, we're really just pushing pressure down. That's not good for the long term. So as we're practicing these movements, we're really using each one of them as an opportunity to lift and engage and strengthen through all of these muscles. So just as a review, we're gonna start by bringing feet in close, lean forward with a long spine, and then exhale as we stand. So in these early weeks, you can be using this as one of your exercises to bring all of your muscles back on board, even as you are still recovering and going through those early phases of healing. Once you're through those early 6 to 8 weeks of healing, you'll want to continue focusing on a low impact strength and stability program for at least the first 3 to 4 months postpartum. This is for a lot of reasons, including just giving time for the pelvic structures and the pelvic floor to recover from pregnancy, no matter what kind of a birth you've had. But it also allows your cardiovascular system and your hormonal systems to level out so that when you do get back into more vigorous or intense activity, your body is really ready for it. So sticking with a progressively challenging, mostly low impact exercise routine really will play into your success down the road if you can stick with that for the first 3 to 4 months postpartum. When we're talking about strength and stability exercises to be included in that first 3 to 4 months postpartum, we want to focus on bringing all of these muscles together and really paying mind to how our breath and pelvic floor is coordinating. So as we move through some of these next few exercises, we're going to talk about that breath, engaging that core and pelvic floor, and then doing the broader movement so that everything is coming together and working together to keep all of your structures safe and healthy. So let's start lying on our backs. We're going to start with a bridge. This is a wonderful postpartum exercise, and you get bonus points for doing it with a baby on your lap. So if we start lying on our backs, we take that big breath, relax all the structures in your trunk, exhale, gently pick up that core and pelvic floor, and then press through your heels to lift up. There are lots of ways to do a bridge. Some people like to go really high, but for postpartum recovery, I'm going to suggest that we really focus on the glute muscles and squeezing them in coordination with just a little activation of our core, and then come back down. We're really trying to bring all these muscles back into alignment and coordination, so we don't need to press way up to the ceiling for this purpose. If you want a little bit more challenge, you can lift one leg up in the air and press through 1 foot at a time so you're getting that single leg bridge. You want to pay mind to your hips and make sure everything is working together and vertically aligned. So another postpartum exercise you can do lying on your back is to engage those core muscles. Exhale, draw everything in. You don't want to squish your lower back. And then lift one leg at a time. And then bring it back down. So this should not be painful. You also should not need to hold your breath. I want to exhale, pull everything in, and then lift the other leg. So I'm paying mind to my hip bones. I'm not letting them rock back and forth. And I'm also trying very hard not to squish my lower back into the floor. Okay? So if I need to, sometimes I might put my hands under my low back just to make sure that that neutral curve is still there. And everything is nice and aligned. Beautiful. Let's flip to hands and knees. And we're going to go back to this position where we started in those early weeks of reconnection. So from this hands and knees position, wrists are under the shoulders and knees are under the hips. Our spine is long and in a nice neutral position with an easy curve in your lower back. From here, we find those core muscles, and then we can challenge this position by lifting one leg and the opposite arm, and really reaching to opposite ends of the room as we do so. Try your best to keep that spine nice and long and to keep your body from wobbling around. So if I think of my hip bones as headlights, they're going to be pointing straight down towards my mat. So my shoulders are back, spine is long. I'm going to kick one leg back, keep my hip bones pointing down, and reach the opposite arm up. This is a beautiful warm-up and really engages that transverse abdominis to help stabilize that midline of the body. So it's a wonderful one for those early months of postpartum recovery. We can also come down to a side plank, okay? So let's tuck the bottom knee underneath, or the bottom leg underneath, so that we're in a modified position. Shoulder down and back, away from the ears. And we're going to exhale, pick up that pelvic floor, feel your belly button drawing in, and lift up to the side. So if you are really able to pick up all those pieces and draw in from your midline, a side plank is absolutely a safe exercise to do for postpartum moms. If you are finding that you're holding your breath or otherwise pushing out at her abdominals, that is when it becomes a little bit less ideal. So if this feels like a strain or like you have to hold your breath, let's work on some of these other exercises first and come back to this down the road. But if you're able to pick everything up, pull everything in, exhale as you lift, even just holding for 2 or 3 seconds at a time and building as the weeks go by, that can be an excellent core connection piece for those early months postpartum. Now we're going to stand up. We've done a sit to stand, which you've been practicing since day 1 because as a mom, that's something that you need to be doing. So we can bring in a freestanding squat whenever your pelvic floor and any pressure or heaviness around that area feels ready. We want to make sure we're able to do this without pushing down or feeling a lot of pressure or heaviness in that pelvic floor area. So if we're going to do a squat that's freestanding, we want to pretend that there's a stool or a chair behind and sit back and down. Keep a nice long spine, weight is evenly distributed in your feet, and as we go to stand, we're picking up the pelvic floor and those lower abdominal muscles. So inhale down, exhale up. Inhale down, pay mind that we're standing fully nice and tall with the pelvis nice and neutral, and we're not overshooting and bringing it way forward, right? So inhale down and exhale up. One more standing exercise that you can do, particularly with a baby in your arms, is a lunge, a reverse lunge to be specific. So I would start with a handhold if you haven't done this yet, postpartum. And you're going to start with your feet hip width apart, take one foot back, drop into a little mini lunge, and then step forward, okay? You can do the other side there too. So if you're watching me from the side, I am stepping back, My spine hinges just a little bit, my hips push back just a little bit, and then I'm going to press through that front foot to come all the way back to standing. So I am leaning slightly forward and then pressing through that front foot. We're also paying attention to where that knee is here. All right, so little mini lunges. You can do these walking along the hallway or the kitchen. We want to exhale as we come up. After the first 3 to 4 months, you've been working through your strength and stability, you're feeling strong and ready for more. That's the point where you can start to introduce some running or some impact. You'll want to keep an eye out for any symptoms that indicate your body might not be quite ready. Some of those symptoms include pressure, heaviness, a sensation that something is falling out of your vagina, any increased bleeding that's not associated with a menstrual cycle, urinary incontinence, or pain of any kind. Those symptoms indicate something is going on and you might be doing a bit too much too soon. They're also a great reason to contact a pelvic physical therapist to help guide this return to fitness so that you can set yourself up for success all the way through the rest of your life. This is an excellent opportunity to just check in, make sure everything is functioning really well, and shore up all the pieces so that you are really thriving as you get back into your fitness routine.